This is the underside of the liver, and B7 is the artery, hepatic artery proper, and B8 is the hepatic portal vein. Up here we have the hepatic veins, which is also seen here. The blood goes from the underside and then goes up and goes to this thing, the inferior vena cava right there. This is the aorta splitting into the right common iliac artery. That's the internal iliac and the external iliac, which turns into the femoral. This, by the way, is the right common iliac vein turning into the inferior vena cava. This is the left atrium. This is the celiac trunk, followed by the superior mesenteric artery and the inferior mesenteric artery. This is the right common iliac artery. This is the right atrium here, and if you look up in there, that's the foramen ovale, or actually fossa ovalis at this point. This is the aorta. This is the pulmonary arterial trunk. This is the ligamentum arteriosum, a remnant of the ductus arteriosus. This H3 used to be a hole in the heart between the right atrium and the left atrium. This is the superior mesenteric artery. I'm sorry, this is the superior mesenteric artery. This is the celiac arterial trunk, superior mesenteric artery. These are the gonadal arteries. This is the aorta, of course. And this here is the right and left common iliac arteries. This is the inferior mesenteric artery. This is the inferior vena cava. This is a fetus. This is the parotid gland. This is the lacteal in the small intestine, and these are the villi, the villi, villus. This is a villus. This is the stomach's muscularis layer. This is on the greater curvature there. This is the pyloric sphincter. That is the cystic duct. G8 is the cystic duct. This is the duodenum right there. Duodenum. That's the stomach. Esophagus up there. This is the transverse colon. This is called Taenia coli, that worm-like muscle. This is pointing to the mucosa. This outer part here is called serosa. Serosa, that's the appendix. That's the anus. And this is the small intestine, serosa of the small intestine. Here's another villus, and the green thing is the lacteal turning into the lymphatic vessel here. Each cell in the villus has microvilli on it. The microvilli add surface area for absorption. So a villus is made up of many cells, including these surface cells here and some goblet cells that make mucus here and there. This is the ureter here, ureter. This is the renal pelvis. This is a minor calyx, and when two of them get together, that's a major calyx. Minor calyx, minor calyx, minor calyx, major calyx. This is a renal pyramid, medullary pyramid, renal pyramid. This red blood vessel here, this is the arcuate. The arcuate right here, this is the arcuate. That red one is the arcuate artery of the kidney. This is the glomerulus of the kidney. D3 here is the umbilical cord. The umbilical cord has two of those arteries that are blue that come off the iliac artery, internal iliac, or arteries. And the red one is a vein. It's called the umbilical vein, and this is the umbilical cord. This is looks like chorionic villi, but this really is the placenta. So this is the placenta, the umbilical cord, and those little things that look like Christmas trees, those would be at some point the chorionic villi. This is the trigone. So let's move on. Let's let trigones be trigones. That's the trigone there. And the urinary bladder, that's the ureter right there. Actually, right there, that's the ureter. Right there, the ureter. Kidneys, of course. This is the testicle. We have the artery called the testicular artery. And this is the vas deferens here, or ductus deferens. This is the ureter. This is the glans penis. This is the gonadal vein. That is the epididymis right there, epididymis. This is the scrotum. That's the prostate gland. This is the seminal vesicle. This is the foreskin, or prepuce. Prepuce. I think it's an Italian word. They pronounce it something like that. This is the urethra. This is the testicle. This number M18 is the ejaculatory duct. This is the urethra. This part of the urethra right here is called the prostatic urethra. This intermediate part here is sometimes called the membranous urethra, or the intermediate part of the urethra. And then it's called the spongy urethra that runs through the corpus spongiosum. It is also called the penile urethra, or spongy urethra. By the way, this is one of the two corpora cavernosa, so it's a corpus cavernosum, singular. This is the thymus gland. This is the thyroid gland. This is the right adrenal gland right there. This is the pancreas. This is the spleen. This is the pituitary gland, and that's the hypothalamus. That was the thymus gland. This is the diaphragm for breathing. This is the ovary. It looks like the ovary right there. This is, believe it or not, a vein. It's a pulmonary venule, and this is a pulmonary arteriole. This is actually a vein. This is an actual artery. It's called bronchial, B-R-O-N-C-H-I-A-L. They feed the actual bronchial organs here. Comes from the left ventricle. This one comes from the right ventricle. This goes to the left atrium. This is the hyoid bone, thyroid cartilage, cricoid cartilage, trachea. So hyoid bone up here, thyroid cartilage. Right, actually left primary bronchus, secondary bronchus. Secondary bronchus, this would be a tertiary bronchus here, breaking up into smaller pieces. This is pulmonary. This is a bronchiole, a terminal bronchiole, actually a respiratory bronchiole. This is a terminal bronchiole probably. The smallest ones are the respiratory bronchioles, and the larger ones down here are probably the terminal bronchioles right there. This is, again, artery, believe it or not, pulmonary arteriole. This is the cochlea of the ear for anatomy part 1 or 2, depending on your school. This is the eustachian tube, also called auditory tube, also called pharyngotympanic tube. This is the superior lacrimal canaliculus of the eye, of the lacrimal apparatus. Superior lacrimal canaliculus. This is the cornea. This is the retina, rods and cones. It's the photoreceptors. These are the rugae, rugi of the vagina. This is pointing to the unfertilized ovum or ovulation. This is the corpus luteum. This is the endometrium of the uterus. This is the myometrium of the uterus. This is the ovary again, it looks like. This is pointing to the ovarian ligament right there, the ovarian ligament right there, and that's the fallopian tube. So the ovarian ligament is right next to the fallopian tube. This is the ovarian artery or vein there. It looks like the blue one is the vein, and the red one is the ovarian or gonadal artery. Labium majora here, labia minora. Now the singular is labium majus, actually labia majora and labia minora, and the singular is labium majus, labium minus. This is the urethra, vagina, vaginal rugae, ridges. This is the uterine os, cervical os. This whole thing's the uterus. Cervical os. You can also see the cervical os here, right there. That looks like half of the cervix. The other half has been cut out. This concludes the female. Wait, there's more. This is the yolk sac. The yolk sac. This is embryology and the study of the fetus. This is the corpus luteum right there, and that's ovulation happening there. Fertilization is happening right there. You can see the sperm cells there. So that is the corpus luteum. Now this, there's more with the female. This is the mons pubis. This is the clitoris. This is the symphysis pubis, which is made of cartilage, fibrocartilage. This is pointing to the myometrium, and this is pointing to the fimbria, the finger-like projections of the distal portion of the fallopian tube, or maybe you could say proximal portion, depending on where you think it starts. I guess it starts here, I suppose. This is a student project, very nice one here. This is, I actually put this on there. This is the sperm cell. The acrosome is at the tip, so there's enzymes there. And then the nucleus would be here. So this is the acrosome. This is, looks like ovulation is happening here. This is the ovary. So this is ovulation. This is the unfertilized ovum right here. There's the sperm cells there and the acrosomal tip there, and that's fertilization about to happen, so that's called a zygote. And then it becomes 2 cells, 4 cells, and then morula, and then the blastocyst embeds in the endometrium of the uterus and grows for several months. And then, so this is basically transit of the so-called pre-embryo, which is what our book actually called it, believe it or not. This is a very nice made in Japan model that shows you the celiac trunk right there, the celiac trunk, superior mesenteric, and then of course the renals, the gonadals, followed by the inferior mesenteric artery, and then that's the aorta splitting. So basically one way to remember this is the TV show CSI. You got CSI. It's a long TV show, so you might need to pee. So basically C, celiac trunk, S, superior mesenteric, I, inferior mesenteric, and these are the gonadals. These are the renal arteries. This would be testicular or ovarian. Now in men and women, this is the left gonadal vein, which drains into the left renal vein, whereas this is where the right gonadal testicular or ovarian vein drains. So the drainage on the left is not as good as the drainage on the right, which is one of the 2 major reasons probably that men have left testicular varicoceles in about 15% of men anyways. And this is the ureter that fell off there. So this concludes the video. I hope you enjoyed. Oh, by the way, this is a fetus. This looks like a very early fetus. If it looks human, it's a fetus. If it doesn't look human, it's probably an embryo, although even an embryo that's human looks human to the trained eye. At 8 weeks, it's called a fetus. At 7 weeks or earlier of gestation, it's called an embryo, or as we saw earlier, a pre-embryo. Okay, so hope you enjoyed this video. This is introduction to the reproductive system, as well as a review of some of the structures from earlier this year, such as the digestive system and, of course, renal system. Hope you enjoyed it. Take care. Goodbye.